Hello, this is Kate Birch, and I'm giving you a short presentation on who is Free and Healthy Children International and what do we do. This is an outline of this little slide presentation. Who is FHCi, how the work started, who are our stakeholders, what kind of past research that we've done, why are we looking at homeoprophylaxis, some of the basic homeoprophylaxis concepts, introducing all of our new HP programs, and how to access HP for you and your family. We started with the work of Samuel Hahnemann, who more than 200 years ago actually was treating infectious disease with homeopathy. In my own journey, I decided to gather all the information throughout all the homeopathic texts to publish the book Vaccine Free: Prevention and Treatment of Infectious Contagious Disease with Homeopathy. This was published in 2008, and since that book has been published, there's been more and more people coming to find out about the work. In 2011, The Solution was published. I co-authored that with Scilla Whatcott, and that's a parent's guide to educating your immune system. I had been introduced to Dr. Isaac Golden in 2008 in Cuba, where he presented his research on his full childhood immunological program, which at that time in 2009, I returned to the US saying this is what we must have within the US. Because all of the parents were saying, help, what do we do? There's too many vaccines. I don't want to vaccinate. Is there another option? How can we do this? And so in 2009, began work to put together research within the US, and Free and Healthy Children was formed out of that initial design phases, founded in 2011, and is now a 501c3, a nonprofit organization doing research, education, and access to HP as we have it. We know that infectious disease is a normal part of life. We have an immune system that has been designed to work with infectious disease. We have bacteria and viruses that have been in our environment ever since we've existed, and our immune system works with those bacteria and viruses, and through that immunological process and immune system memory and learning, there's evolution of humanity. We do know, however, that sometimes if an acute disease process is not resolving, it leaves a miasm, which therefore creates a disease tendency. And we've seen that with the COVID situation now, that those who contract it, it can either pull forth pre-existing conditions, or it can put on a new layer of ill health on the individual unless they figure out how to solve that. That is called a miasm. We understand that childhood infectious diseases are part of childhood immune system development, and that process is a normal process for children. And we also understand that immune systems can be educated with immunological agents, such that a vaccine with adjuvants that produces allergic responses will educate the immune system towards allergies. With homeoprophylaxis, where it's just using the nosode, is educating the immune system towards what would be the normal eliminatory route for that particular disease, and therefore educating the immune system and building immunity. And then we started our work with our full childhood HP program, and we've continued our work and are about to launch all aspects of this work. We have a practitioner certification. All of our supervisors are trained and educated in homeoprophylaxis. They've gone through research training, so they're part of our research platform. And we have our patrons. Those of you who wish to access the homeoprophylaxis program would become a patron of FHCi, and then a doorway opens to an amazing system of immunological education for all ages and stages of life. Who are our stakeholders? You are our stakeholders. We have children, we have families, young adults, travelers, sexually active individuals, pregnant moms, elders. These are our core groups. We have programs designed for every one of them. We have our HP supervisors. We have the FHCi board, which governs and oversees all the work, supports the supervisors, and is continuing to seek a path forward in the work that we're doing. We work to serve the larger community, and ultimately, we work to serve the health of humanity through creating or facilitating the development of healthy immune function and all of the places in the human body that that immune system interfaces with. So why homeoprophylaxis? Well, we have our initial childhood program to say that across the board it's enhancing childhood development and can serve to prevent from vaccine injury if it's given before and after vaccines. But we wanted to do more. We wanted to go further. We wanted to see if we could reach into humanity even more. The pandemic taught us a lot, not only about infectious disease, but it taught us a lot about the systems at play with the government and the medical system and the sort of distorted picture of how the immune system really works with the disease. And then when you have a disease or a genetic strand such as COVID is, that plays with so many different parts of the immune system and pulls out all the sicknesses. Those people with previous existing conditions were the ones that suffered from COVID. And so the question is what can we do for humanity to begin to change the trajectory of the health of humans? And so we were looking at, the massive rate of infertility. What's happening with sexual health? What's happening travel? How do you stay healthy while you travel? How does the immune system correlate with healthy maturation of the mind and body? What about genetic mutations and epigenetics of now we've got many gene mutations that are affecting different processes in the human health? What about those with immune system collapse or the health of elders in their family setting? These are the questions that we want to answer with our rollout of programs. We have, first one is a healthy biome. The foundation of all health is based on the vitality of the biome. We next have our full childhood immunological program that just has a few shifts from what we have been offering in the past. We have a young adult and college prep HP program, which is designed to not only protect during the college years, but also to facilitate what the advancements of cognitive function and reasoning happens during that young adult mind. Then our travel HP, of course, is exposing one to what they would be exposed to in new and unknown environments. We have a healthy sexuality and pre-procreation HP, which can do some corrective immunity, but can help align the potential couple towards, the sacredness of that intimate connection and the viability of their offspring. We have a healthy pregnancy and fetal development HP, and that is to help clear some potential disease tendencies that the mother might hold so that the fetus is freer in their life. And then, of course, our immune health for seniors to ensure that they remain a healthy part of the family instead of in isolation, to ensure that their immune system memory is prolonged or reactivated, whatever immune system memory they developed as a child. And then we have the capacity to manage other single disease prevention HPs based on, environmental or particular needs wherever you are. The work of our organization and our practitioners and you as families and in the current medical model of infectious disease, there is real deep questions about the origin of disease. And the germ theory is what we've been operating on for the last 150 years, but it's being called into question, and homeoprophylaxis works on the understanding of a vitalistic approach to health, means that it's the health of the individual that actually determines how well they fare through infectious disease. Through our work, we are establishing homeoprophylaxis as a dynamic healthcare system. Health is a balance between the germ and the terrain, and you are the terrain, and together you have health in your environment. Become an FHCi patron. Find your HP practitioner and start your HP program today. You can visit us at freeandhealthychildren.org to learn more. And to good health, we wish you the best.